Okay. Yeah, thank you very much, Khan, again for giving us the platform to talk about important issues that affects our health. And today we are going to be talking about men's health. And men's health affects everyone within the household. So I know that it's always ladies who join this session with a few men, but this topic is very vital. It's not just about men, it's also about women. We are going to be talking about abdominal fat, and abdominal fat doesn't affect men alone, it also affects women. A lot of us spend so much time and energy and as well as money to go to the gym, to work out so that we can reduce abdominal fat. But I mean, we may not know that having the right information and being aware of what to do to not have it in the first place is what we need. And so as we usually do, as Khan provide us with this platform to discuss some of the issues weekly, today we are going to have a dietitian, a registered dietitian who is not very known to us. I mean, he's been on this platform several times. We've invited him a number of times to come and talk about dietary issues, and today we have him again, Alistair Kumi, to take us through this discussion about abdominal fat. He titles it with a very catchy phrase, so I'll allow him to introduce the topic, and then we can get the discussion started. So Alistair, if you are ready.
Thank you, Dr. Robert. What I'm going to do is I'm going to share my screen so that I can go straight into that presentation. Apologies to everyone, because I live very close to the hospital. You may catch a few sirens in the background, so don't mind the sirens. Just mind who's speaking at the moment. So yes, as Dr. Robert so eloquently put it, today we're going to be speaking about abdominal fat, and I've titled it as a men's health special because we're taking a look at men's health specifically around the Dadbod, or the pot belly, as they're colloquially called, and today we're speaking about how to address it. So you know, we all know someone within our families, within our communities, who has a particular build. So there's a particular build of body that's associated with actually being a man in our cultures in Africa and in the Caribbean. And today we're going to address exactly, you know, what goes behind that kind of body shape, whether it's a healthy thing to have, whether it's an unhealthy thing to have. And then we're going to be taking a look at how such a body shape actually develops, and how we can also, you know, improve our health by improving the shape of our bodies. So this is in no way stigmatizing a particular body shape. It's actually taking a look at the health connotations related to that shape and the kind of health risks associated to that shape. And, you know, as we know, knowledge is power. The more we know, the more we can, you know, liberate ourselves from the kinds of diseases that are ravaging our communities disproportionately. So I'll move on. So yes, my name's Alistair. I'm a primary care diabetes specialist dietitian. So I specialize in diabetes, but have an extensive history in weight management and obesity management. I also have an extensive history in the cultural management of foods as well. You know, I did a short stint in acute dietetics in hospital work, and I also did a bit of a stint with metabolic disorders, so lipid disease, renal disease, things like that as well. So I have a little bit of a littered history when it comes to you know, all aspects of health, and then that's what we'll be covering today. So I'll give you just a quick look at the contents. So in the contents, we're taking a look at what is the Dadbod, or the pot belly. We're going to be looking at the dangers of that said body shape. We're going to be looking at what a calorie surplus is, And we're also going to be looking at effective weight loss strategy. And I'm going to make sure I leave a little bit of time so we can do a bit of a Q&A at the end before Orlando comes in to lead on the physical activity side of things as well. Yep. Am I correct in believing that Orlando's coming today as well? Brilliant. Yeah, all good. So yeah, so Orlando will be coming today as well. And actually Orlando is doing probably the most important aspect of being able to manage sort of adipose tissue, abdominal fat, and overall health. So I'm really going to be keying in and setting up the room for Orlando and his work today as well. So we'll be moving on. What is the Dadbod? So the Dadbod is characterized by this overnourished state. As you can see on the right-hand side, we've got the very famous Lord Smith, who is sporting his Dadbod here. So he went through a period where he wasn't getting as much physical activity in. He wasn't really watching his diet. He was between movie roles at that time as well. So he gained a little bit of weight. And as you can see, the weight that he had gained had actually been mostly centered around his abdomen. And there was some extra sort of adipose tissue or fat buildup around his pectorals as well. So yes, as I was saying, it's characterized by lean arms, lean legs, drooping pectorals, and most notably a protruding lower abdomen or pot belly. And this sort of body shape is made up of adipose tissue deposits. And what adipose tissue is just under the layer of your skin, under the dermis of your skin. You have these fat cells that are used for just storing extra energy in the form of fat. And that fat is used to help to insulate your tissues, to keep you safe. It's actually also used in hormone regulation and control as well. So fat isn't a bad thing, but we know that obviously having too much can be dangerous to your health, and we'll be looking into that later. So when it comes to these adipose tissue deposits or this subcutaneous fat, we know that it arises for several reasons, and the most notable reason is being an extended calorie surplus. So that means taking on more energy than your body needs to use, or that your body is using at this point in time. It's also characterized by an extended lack of physical activity as well. And it can also be linked to hormones and stress. So the reason I've linked the two of these together is because stress itself, can be brought on by metabolic reasons. I'll go into those later. And another thing that also can drive stress is the actual stress hormone cortisol. So that's why I've linked sort of stress and hormones together. So we know that during periods where your cortisol levels are running at an extremely high level, actually that can lead to excess deposition of fat. So that's why it's very important to be aware of actually how much internal stress you're dealing with, how much external stress you're also dealing with as well. And also be very mindful of how much sleep you're getting, because the less sleep you get, the more likely you are to produce excess cortisol, meaning that your body is going to be in a stress state, which also means that you're more likely to deposit adipose tissue. So do not neglect sleep. So yes, I put this picture up because it's just a very good characterization of what the Dadbod looks like. So usually with the Dadbod, that's also associated with sort of men getting to a certain age, who may be married, maybe in a family situation, who are prioritizing, so taking care of their family, prioritizing working, but aren't so much prioritizing their personal health needs. All right, so for us to move on, what are the dangers of the said potbelly? Well, we know that it increases type 2 diabetes risk significantly. Why is that the case? It's because when you have that extended waist circumference, you're more likely to be more resistant to insulin. Insulin is a special hormone that your pancreas produces, and when it produces this particular hormone, it helps to package away the carbohydrates that you've been eating. So when you eat foods, they break down into a special sugar called glucose, and your body packages it away into your cells so you can use it for energy and things like that. When you have this increased adipose tissue around your abdomen, where it seems to deposit in men mostly, you become a bit resistant to insulin, meaning you can't package sugar away very, very well. So it means that actually your glucose tolerance tends to go down. So your blood sugars can be rising in the background over time. And after a while, your body gets a bit tired of that, and you can go on to develop full-blown type 2 diabetes. So it's very important to be aware of that risk. We know that the pot belly also increases risk of early heart attack or stroke. And what we mean by early is having a heart attack or stroke before the age of 50. So it greatly increases that risk. We know that, it also increases the risk of hypertension, arthritis, heart failure, irregular heartbeat, sleep apnea, and chronic obstructive pulmonary disease. So, with regards to things like sleep apnea and chronic obstructive pulmonary disease, having that extra fat around your torso is putting a lot of pressure over your respiratory organs. So when you're lying down and sleeping, sometimes if you're not careful, it can close off your airway, meaning that during periods of the night, you're not actually breathing as well. So that puts an immense amount of stress on your body. We know that with things like heart failure and hypertension, that's directly linked to having extra fat floating around in your blood. So if I was to move down a bit further onto the next point, we're looking at sort of men of African and Caribbean heritage. And it's not just men, it's women too. We know that, where we come from, we are genetically predisposed to something called metabolic syndrome. So metabolic syndrome is characterized by a trifecta of insulin resistance, hypertension, where your blood pressure is super, super high, and hyperlipidemia, where you've got a lot of excess fat floating around your bloodstream. So you're not packaging it away as well. And, we know that having this increased abdominal fat can be the final modifiable piece of the puzzle that leads to a long-term irreversible condition. So I keep on coming back to sort of this body shape being, just that, a very, very important piece, because it's a piece that you can modify to help to reduce your risk. And, the reason we're homing in on this is because actually this starts from a young age. So, from 25 to 40, this is when this body shape is actually created, and is created over time. And that goes for women as well as men. But the reason I'm homing in on men is because actually these are the key fathering years. So we always speak about women, being at their peak fertility time. We're also looking at men also being in their key fathering years, even though men can continue to father children well into their 90s, because they're going to continue to produce sperm. Their key fathering years, where you're most likely to have your child, will be between those ages. And the reason I'm saying that, I'm bringing this up is because even if you don't develop a chronic condition between 25 and 40, you have to think about the quality of genes that you're passing on to your progeny or through your sperm. So we know that you're presenting quite a bit of genetic material through your sperm in order to father a child. And even if you haven't yet developed a long-term condition, you will be passing that on to your children, and your children are more likely to develop these sort of chronic conditions like marked insulin resistance, hyperlipidemia, and have hypertension when they're a lot younger, and even while they could be fit. So it's important to make note of that, because it may not be affecting you, but it will affect somebody. That's why it's very important to be aware of your health. And lastly, in a link to those key fathering years, we know that men with increased adiposity actually are at higher risk of erectile dysfunction. And one of the reasons for that erectile dysfunction is, having hyperlipidemia, so more blood fat floating around their bloodstream, hypertension, We know that when it comes to sort of those male reproductive organs, they rely a lot on blood vessels. And if the quality of those blood vessels isn't great because they've been filled up with fat, blood flow is inhibited. It can affect, it can affect your virility as a man. And we know that when that virility is affected, it can have effects on, sort of your mental health. It can have effect on your physical health as well, and on your relationships. So it's very, 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 very important to be aware of these things. Just to give you I was going to say a personal example, but not that personal, but, anecdotally in clinic, I've had younger men, come and speak to me in clinic about the fact that they have been suffering from erectile dysfunction, and they haven't really had many avenues. They haven't had many avenues to discuss that with other clinical professionals. And they've asked for advice on actually what to do. And sometimes just by losing about 5% of your body weight, or by reducing your body fat percentage, by reducing maybe your cholesterol levels, things like that, some of those men have actually been able to improve their virility and their ability to sustain an erection over time. So it's really, really, really key stuff to be aware of and to make note of. So I'm going to speed on. How does it develop? This is what everybody wants to know. The short answer is it's just spending time in a calorie surplus. So I'll give you an example. The average male height in the UK is 5'10". So that's about 178 centimeters. If we work backwards, we know that going from that, an ideal body mass index for that height is about 25 kilograms per meter. So that's the sort of upper limit of what an ideal body weight is, a body mass index is. So the ideal weight for that person would be about 79 kilos. For a man that height to maintain a weight of about 79 kilos, if he's sedentary, if he's doing a job a lot like mine, sitting by computers all day, speaking on the phones or speaking to people face to face and not really getting a lot of movement, he only really needs about 1,800 calories a day to maintain his body shape, his size, and his energy levels. And he would also need to be vigorously active 3 times a week. So, whether that's going into the gym, playing badminton, going for a jog, 75 minutes per session, 3 times a week actually isn't a great deal, is it? And this would also mean that if they're very physically active, you could consume an extra 250 to 500 calories worth of lean protein or fibrous carbs to help to maintain muscle mass, even build muscle mass, strength, and energy. All of these things actually will help significantly in being able to, 1, increase your virility as a man, and number 2, being able to maintain a lean body shape as well. And it's also very important to note that that man would need to get 8 hours of quality sleep a night to help to restore their hormonal balance. It will also, during that time, encourage human growth hormone production. So, if I go back to those key fathering years between 25 and 40, men are producing a lot of human growth hormone and testosterone during that time. Well, specifically testosterone, which is why men are able to maintain quite a lot of muscle mass between 25 and 40. After 40, testosterone takes a little bit of a dip, as is expected, not because there's anything wrong with that man, but because that's part of the aging process. You're not supposed to be holding on to massive amounts of testosterone for long periods of time. As time goes on, that testosterone does dip, as is the healthy aging process. And, we know that human growth hormone and testosterone, they help to support muscle recovery when you've been working out. Next, that individual would need to be drinking at least 2 liters of water-based sugar-free fluids to help to hydrate their muscles and their tissues. So that's just taking a look at a nice healthy man and how they would maintain that weight. But what happens is with a lot of men, they're actually consuming way more than sort of 1,800 calories a day. And I'll show you exactly why that happens and why it's so easy to slip into this and why that Dadbod is so prevalent. So if I go, I'm just going to go to the next slide, sorry. Yeah, so where do things go wrong? Before 25, it'll be interesting for you all to know that actually most men can consume an excess of about 3,000 calories a day to maintain their lean body mass, especially those who are extremely active. So I was speaking to Shekinah earlier, and I was letting her know that, one of the men I see privately, he's a powerlifter in the UK. And he eats about 3,500 calories a day, and he maintains a very healthy weight of about 92 kilograms. So he is very, very, very muscular, very, very, very strong, but he needs all those calories, because he's in the gym 5 times a week, lifting very, very, very heavy weights. And the reason why before 25 you can consume these many calories is because you're putting out a hell of a lot of human growth hormone and testosterone to help you to fully mature into a full metabolic male adult. So your energy requirements are very, very high. So there's actually fairly little consequence to an overconsumption of calories, because yes, you pretty much are using every calorie to grow. So, I was going to throw in some colloquialisms, where, some people may say that, some men may say that, oh, when I was younger, I could eat this, this, and that, and not put on any weight. You'll even hear some mothers, sort of say, oh, after my son got married, he put on so much weight, his wife must be feeding him well. You hear those sort of colloquialisms. But the thing is, after you've reached full maturity, sort of at around the age of 25, 26, your requirements drop significantly. So like I said, if you're a sedentary worker, which a lot of us are now, a lot of us are working very administrative roles, your requirements are between 1,500 to 1,800 calories a day. And that becomes enough for you to maintain your weight and actually maintain your body shape too, especially when you are doing physical activity. So I know Orlando is going to be going through that today. So I cannot stress enough how important it is to maintain a habit of regular physical activity. And I'll show you what that looks like in the next slide. So, I was just highlighting at the bottom that where we go wrong is that a lot of men, continue to eat like growing boys. And the addition of alcohol can make us more susceptible to fat storage. The reason I brought in alcohol here is because when you drink alcohol is a toxin. Our bodies are not really wired to use alcohol sort of day to day. So when you drink alcohol, your body goes under attack. So what happens is your liver is gonna prioritize just trying to clear that alcohol 1 unit at a time. For some people's livers, they're processing 1 unit of alcohol at a time. So for reference, that's just having a shot of vodka. It's going to take your body a good hour to process it. Even if you feel fine after drinking it, your body is still shutting off all its other metabolic, or your liver's shutting off all its other metabolic processes just to process that. While that happens, it means that the liver can't focus on helping you to clear cholesterol. It can't focus on helping you to package your fats in a healthy and ideal way for excretion. So what happens is the more alcohol you drink, the more you're shutting off your liver to those other processes for hormones and fat. So it just means that you end up actually depositing the fat from the foods that you're eating, or fat that's floating free in your blood anyway. So, even if you're not eating that much but drinking a lot of alcohol, you can still develop that Dadbod physique, which is why, which is where that term beer belly came from. Because, you get some men who drink a lot of beer, and actually what happens is they end up just depositing all the excess calories they eat on their abdomen. So for men, the key sites for depositing fat are on the abdomen and on the pectorals, as mentioned before. So weight gain, how easy is it? It only takes 100 calories above your maintenance calories, people, to gain 4 kilograms a year silently. So if we think about our gentleman who's 25, he's in peak male physical shape. And, he's working a sedentary job. He's not working out like he used to, in his early 20s. After a year of just eating 100 calories above his maintenance calories, that's as simple as having, yes, that extra shot of vodka, every day. Or that's as simple as having 2 extra digestive biscuits a day. That's as simple as having a quarter of a bottle of a supermalt, or about 100 or 200 mils of milk extra, on top of your maintenance calories. So if you continue doing that every day over a 10-year period, that's our man from before going from 79 kilos to 119 kilos in 10 years. So that's 40 kilos weight gain, and it's very, very easily done. And the thing is, I've known some men to be able to achieve that kind of weight gain a lot more quickly And that's because a lot of us in this country are not actually over consuming by about 100 calories. Most people are actually over consuming by about 200 to 300 calories above what their bodies actually need. So it means that you could gain that weight in 3 to 5 years if you're not careful. So as we know, when excess calories are eaten, excess carbohydrates, fats, protein, they are stored in the adipose tissues, especially when your diet is high in fats, whether it's healthy fats or unhealthy fats. Your body can only really process fats one way. So your body will store that excess fat around your abdomen, and it will find its way to your pecs and under your lats, depending, like I said, on how much physical activity you're doing as well. So key question, how do we get rid of it in my last few minutes or last minute? Step one is you have to think about how you got there and your foundations. So the question I ask all my gentlemen who come into clinic is, has your physical activity dropped significantly before you started gaining weight? If so, you need to aim to get at least 30 minutes of exercise, 5 times a week. It sounds hard when you say it on paper, but when you're actually doing it in practice, that's as simple as going for a 15-minute walk twice a day, and doing that 5 times a week. That's how not to oversimplify it, but that's how you can slip it into your routine if it wasn't there before. And you don't have to start at 30 minutes. You could start at 5 minutes, 5 times a week, and build up over time. Orlando is going to tell you the importance of progressively overloading your body, because that is what it's designed for. Next, are you regularly consuming alcohol? So, and by regularly consuming, are you having more than 3 units per day? The government has set the recommended safe intake. So they haven't said that this is the recommended intake. They've said that that's the recommended safe intake, because alcohol is a toxin, and that is how they speak about it. So we know that there are absolutely no health benefits from alcohol at all. Absolutely none. So, if you are getting alcohol regularly in your diet, looking at ways you can reduce it and bring that down. Number 2, you want to start thinking about a new maintenance calorie level. So, and actually a really good way of knowing what your maintenance calories are is, don't change anything about your diet. Stand on the scale every week, once a week, and see exactly what your weight's doing. Is it going up by half a kilo? Is it going down by half a kilo? Is it staying stable? If it's staying stable, that is whatever you're eating is maintaining your weight as is. So what you want to do is you want to remove an easy 200 to 300 calories from your diet. The first step I tell people to take in clinic is, number 1, try to go for water-based sugar-free fluids as much as possible. So avoid fruit juices, avoid full sugar fizzy drinks, avoid supermalt, avoid alcohol for a little bit of time. See what sort of impact it makes, because actually, 1 bottle of supermalt is an easy 225 calories. So imagine if you weren't drinking that would, and you had that every day, that's an easy 200 calories you've taken from your diet. So moving down, I was going to say there's a reason I put exercise first all the time, and it's because when it comes to exercise, it doesn't have to be the same thing every time. There are 3 heads of exercise you want to prioritize. Number 1 is your aerobic, which is your walking, jogging, swimming. Number 2 is your mobility and conditioning. And that in mobility and conditioning becomes even more important the older you get as a man. So I'm talking stretches, mobility drills, things like that, because you want to keep your joints as healthy as possible. When your joints are healthy, your risk of injury is a lot lower, and it means you can work out for longer and do more. And number 3, and the most important, strength training, because actually if you're building more lean muscle tissue, it's metabolically active, it's going to work for you. So it means that when you get an 8-hour sleep, you're burning 800 calories, so 100 calories an hour while you do that. But if you don't have much muscle mass, that same 8-hour sleep, you may only be burning 500 to 600 calories during that period of the night. So those are sort of the key, or the whistle-stop tour of addressing the pot belly. So step 1, thinking about your foundations, thinking about your physical activity, thinking about your maintenance calorie level by weighing yourself regularly. Don't be afraid of whatever the numbers are on the scale, because the numbers aren't important. What's important is the trend. Am I staying at this level? Am I going up? Am I coming down? Where am I? And what am I eating and especially drinking to keep me here? So yeah, lastly, give it time, everyone. It's very, very important to remember that it takes time to develop that kind of body shape. You won't lose it in 6 weeks. You won't burn it all in 6 weeks. And if anyone's promising you that, you have to be very, very, very careful, because anything that comes of quickly puts your body in a metabolic response to sort of injury or trauma, meaning that when you return to normal eating or your normal patterns, you're in position to gain weight and actually go further than you were before, because your body's trying to recover from what it thinks was a metabolic response to injury. So you want to lose it slowly, lose it nice and slowly. And what I mean by slowly is if you're losing sort of half a kilo to a kilo per week, or if you notice that your body shape is changing sort of month by month by measuring your waist circumference, that is a really good way to go. And as I said, aiming for a 200 to 300 calorie deficit from your current intake, which looks like avoiding chocolate bars as a snack, avoiding a second helping at dinner, having one less chicken thigh with skin on your plate. You know, I know what it's like to be man of the house. When I got married, I couldn't wait to be able to take chicken from the pot and have no one tell me off. I couldn't wait to get that extra thick chicken thigh on my plate and not have any contest for it. But, you know, if I'm having 4 chicken thighs on my plate, maybe I need to consider just having 1 or 2, so that I can reduce my calorie intake, so that I'm not gaining unnecessary excess weight that's going to put my health and my life and my sperm at risk. So that's everything. I'm leaving you with a quote, and that quote is: "The only person who is educated is the one who has learned how to learn and change." When it comes to these sorts of changes in life, you know, it's all about taking it one step at a time and remembering that, you know, whatever lifestyle you've lived before, it's not going to change, you know, overnight or even in a few weeks. It takes a good, you know, sort of amount of time. It takes 21 days to build a habit, 90 days to make it a lifestyle. You know, so you have to really to take your time with these sort of things and seek professional advice. You can go to your GP surgery. You can ask for weight management support. You can also inquire with dietitians that you see, you know, who are registered with the HCPC, who can give you evidence-based advice. You can actually register with even some personal trainers as well. If it's exercise that is actually your area of focus, that's something that you can do too. So I'm going to stop now for any questions. So what I'll do is I'll close this slide and I'll come on here. There we go.
Excellent. I mean, thank you very much for such an insightful information. I think if we continue to receive information like this, then I think that would age healthily. I particularly like the part that you talk about sleep, because I think that is what most men struggle with. I mean, once you are young, you talked about the fact that when you are young, because of the fact that you are young, you are able to do certain things and go scot-free. But when you start aging, it is no longer the same. But sometimes we think that you are still the same 25 years old man. That part is really very, very important. And if you could stress that more. I think the other part is, well, I have seen, I mean, we have a community where every weekend you go and then you play lawn tennis, for example. So a group of men go to play lawn tennis, and then when we come back home, then we eat a lot. We eat so much so sometimes even doing the exercise can increase your satiety, and that can lead into consuming unnecessarily. And I think those are the things that I have picked up. And I think you ended it well by talking about the difficulty in losing weight. It is easy to gain, but it's very, very difficult to lose. And that is what is demotivating, because when you start going to the gym, sometimes we think that, within 1 month, you want to see changes in your pot belly. It's not coming, then you relax. And thinking that, well, so this is not working for me, and then we go back to the old habits. So I know we have the key to our health, but I mean, I don't know how we can help people to really move away from bad habits to adopting these healthy practices. If there's any question, I know that we are not many today, but if there's any question that anyone wants to ask, please feel free to unmute yourself and ask.
This is your chance for free dietetic advice.
Yeah,
For
I mean,
anybody,
we never get this kind of advice anywhere, except during healthy heart sessions.
And yes, I've seen the question. Thank you, Shekinah. Are there specific diet plans that men can follow to get rid of their beer belly? Yes, there are. One of the best diet plans I've seen out there comes from Diabetes UK. So their whole scope is on healthy eating. So if you go on Diabetes UK, so diabetes.org.uk, just type in meal plans in the search bar. They have meal plans for men, for women, and for different calorie brackets as well, depending on how hard you want to go. And, you know, they're packed with plenty of sort of healthy meal choices that are actually quite nutritionally varied as well. So they provide you a complete set of nutrients. It's a 7-day meal plan too.
Yeah, so she's saying that question is from Facebook. And let me just emphasize that if we do not begin to change your own behavior and practice it at home, I mean, there is no any other information you go online, it will help you because you have this habit of doing things. And I know that my wife doesn't want me to eat after 8, but anytime I always want to find something, then I'll be trying to justify why I want to eat that. And then, but she wants my health, but I don't think that, I just think that she's probably denying me from eating.
Habits.
So it is the habits that we need to change. If you change that, then that is what it would even drive you to go and start searching for those kind of information and consulting experts like Alistair and co. So we need to begin to change our habit. We need to change our behaviors, our dietary behaviors and eating patterns.
I was going to say that if when it comes to weight management, behavior, as you're saying, Dr. Robert, is actually very key. Any of my weight management patients I see in clinic, I don't even speak about dietary interventions. I don't even speak about exercise at first. I speak about their mind to start with, because it has to start there. What are your motivations for losing weight? How much do you want to lose, and why? What are you going for? Because once we know your why, then you can build from there. And, you know, when it comes to behavior change, it's not something that you should do in a silo. So I like the next question about communities that men can join to stay motivated to exercise and keep the weight off. Joining a local gym is actually actually a really good way of doing it. A nice, cheap local gym. The reason I say that is because in the gym, people can be quite scared of going there, or they might feel embarrassed that they don't know what they're doing. What if I was to tell you that when you go to the gym, nobody even cares what you're doing, that everyone's just trying to get their workout and get the hell out of there because they've got things to do. But if you ask for help, anyone would be happy to help you. And there are personal trainers, things like that. And outside of that, if you need sort of further dietary advice, you know, you've got people like myself who are available, who you can inquire with, who also do private consultations and things like that to help you to get to the bottom of certain behaviors and actually help you to build on your existing plans and enhance your, you know, the steps that you're taking with your health. So you're more than welcome to inquire with Khan, more than welcome to inquire with me privately, or find one of my colleagues online who's registered with the HCPC. Ask them if they do any private work, and you'll be surprised at what they'd be able to help you with.
Great. So we are having questions from Facebook and YouTube. Is there anybody who is joining us that who has joined that would have maybe have any question that you would like to pose? Alistair is here. I mean, we never have him give us this free advice after today unless we invite him back. So if you have any questions, please do not shy away from asking it. I have good examples of the fact that I've beginning to change my lifestyle. I talk about behavior because if you just get up at one point and say, no, I think I'm gaining weight, and you go to the gym, you'll never be motivated to continue. But if you start, like Alistair was saying, if you start every evening, you want to walk at least 1 mile. So if you just do 1 mile every evening, and then you increase it to 2 miles, then increase it to 3 miles, and you develop that habit before you now start to increase that level going to the gym. So that's the way you can sustain things. But if you just get up one day and say, it looks like I have put on weight, I have to register for a gym. And that's what most of us do.
Yes. And I was actually going to add to that, actually, in terms of, when you're taking on those healthy changes, do you know your body helps you? So your body is very good at learning the most efficient way to do things. So if Orlando will tell you, when you start a workout program, and let's just say it was just walking, after 1 month, your body configures the most efficient way of doing that walk, meaning that you're no longer going to be able to, let's just say, get the therapeutic benefits of walking in that way. So you're not going to, if you're just doing a 20-minute walk every day, you're not going to really be building any more muscle after a month of doing that. You have to find a new way to stress out your body so that you can unlock the next layer of those therapeutic benefits. So your body gives you a hand month by month by month, and it's basically telling you, keep going, because we're looking for ways to do this even more efficiently. And the good thing about that is the fact that when you're able to walk for 5 miles efficiently, you go from doing that and panting for breath to being able to walk for 5 miles continuously without even breaking a sweat. That is a good thing. Even if the weight doesn't come off your waist circumference, being able to do that has given you huge benefits with your ability to breathe, ability to pump blood to different parts of your body, and also being able to stimulate muscles in different parts of your body and maintaining your core stability in your front trunk and in your back, strengthening your spine, all of those sorts of things. Your body gets more and more efficient at being able to do that, meaning you are becoming healthier and healthier and healthier. So to my men out there, don't be discouraged if you've been walking for 2 months and you're not losing any more weight. If you can walk for 2 miles without having to catch your breath, that's also a good thing. So you want to look for those sort of outcomes as well, because weight loss is always going to be a secondary outcome of any healthy lifestyle you're living. And your body is not going to go down to, let's just say, if you're a BMI of 35, you're not going to go down to a BMI of 25. That might not even be the healthiest weight for you. Arnold Schwarzenegger himself has a BMI of 31, but he is very, very, very muscular. So what you're looking for is you're looking to build a bit more lean mass and lose abdominal fat or lose fat where you can, while increasing your exercise tolerance. If your exercise tolerance is up, you can go as far as you want to go.
Yeah, just to add that, BMI is just a marker. It doesn't really account for your adiposity. So, he can explain the adiposity very well for you to understand, but it doesn't. So if you keep on measuring your BMI and think you are not really making any headway, that's not the right way to go. The fact that your BMI is high doesn't mean you are unhealthy. You just have to keep on the momentum of exercise and watching your eating habits and watching your physical activity and doing all those stuff. So there's a question from Iyabo. Oh no, it's just a contribution, or just thanking you for the information.
No, yeah. You're very welcome.
I have a question. Just as we were talking about BMI and just weight, for the men out there, what's a healthy way to identify an optimum weight that they should be at? Is it more of a personal preference, or is there something they can gauge to know that, okay, I'm this now, I want to get to this? Because some men might have a pot belly, but they look at an image of a muscular man and they give themselves unreasonable goals to get there. So is there a way they can identify, okay, this is a healthy weight I want to be at? Are there any markers, or what's your advice concerning that?
Yeah, so you actually touched on something very, very important. a lot of the people that you will see online, so these sort of muscular men or these fitness influencers and things like that, these people are in peak human physical form, and they may have done some things to also get to that form that, you know, is slightly off the books. So they may be using anabolic steroids, they may be using performance enhancing drugs to get to where they've got to. And they are the top 1% of, you know, what a man can look like. There is a whole spectrum of what health looks like. You know, BMI isn't the best measure, but we use it as a population level measure to give us a rough idea of whether the weight you're carrying is healthy for your height. So we know that an ideal BMI for a man, you know, ranges anywhere between 20 and 25. So if you are 5'7", then your ideal weight is about 72 kilos. If you're 5'10", your ideal weight is probably about 79 kilos, you know, as a healthy weight gauge. If you're a little bit above that, the main aim is to then look at, what does my body look like? What is my body shape like? You know, am I carrying excess fat, you know, sort of around my abdomen? And if that's the case, all I need to do is maybe look at losing 5 to 10% of my current body weight. If I can lose that much, I know I'm going to be in a healthier state. Because actually, the aim isn't to have a six-pack with huge, broad shoulders. The aim is to actually be able to live your day-to-day, being able to carry out your activities of daily living, you know, without, you know, being tired, or without having raised cholesterol levels, or without, you know, having raised sort of blood sugars and things like that. It's about being, I would say, metabolically healthy as opposed to phenotypically healthy, which is what we see online. And the thing is, as time goes on, you will eventually get there if you're consistent with very, 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 very small atomic habits, you know, of, hey, it's a non-negotiable that I'm going to go for this walk today. It's a non-negotiable that I'm going to do these stretches this morning. It's a non-negotiable that I'm going to spend 20 minutes doing some weight training, you know, maybe 3-4 times a week. You know, if you're doing those sorts of things, you'll definitely get to where you need to get to, because you have to be healthy for you. Yeah, healthy for you. But really good question, Shana.
I guess the danger is the danger of those who do this kind of gym just because they want to keep that looks, is that once they slack and don't keep it, you would see the difference. You will see that they would just massively increase in weight. And you can see that from some of the footballers. Somebody like Ronaldo, the Brazilian Ronaldo. I don't know if you've seen him recently.
Oh, yeah.
You know, but you see people who consistently just do the basic exercise. See, they keep on maintaining their body. You don't need that muscles to build it. You see Gary Lineker, for example, you know, he doesn't play football again, but he just has that physique. You know, he doesn't have muscles like others go to the gym to have it, but that is just a normal way to live your.
And you know, there's a reason why. So when I think about Ronaldo Navarro, you know, the greatest footballer of all time, for argument's sake, his when you're doing that level of exercise, he has to eat like an athlete. So those guys are consuming, like I'm saying, about 3,500 to 4,000 calories a day. They're eating a lot because the level of metabolic activity and strain on their bodies is so high that if they don't eat, they just cannot perform. The danger is when you are having to eat like that day by day, and that is your habit, if you're not doing the same level of training, you're going to be in a massive calorie surplus. So the best way to avoid that is actually to, as your activity reduces, so should your calories. Your calories should also come down to match your level of activity, to actually prevent you ballooning in weight on the other side. So a lot of these guys, you know, they have these, you know, sort of big appetites, but no one's really homing it into them that when you're out of season, you have to cycle it back and tone it back. You need to give yourself a bit of a little bit of well, I was going to say a little bit of leeway, but it's not leeway. It's actually, you have to dial it right back and eat like a normal human being. So if I was to show you what like a general athlete eats sort of day to day, these guys they're consuming monstrous amounts of food. So they are eating 2 or 3 times more than what we would eat in a day.
Mm-hmm.
But then again, you also have people in the community who as well who eat like athletes but are not athletes, and hence why they're also gaining weight.
Yeah.
So it's just keeping an eye on, like I said, stand on the scale. Don't change what you're eating for 1 week and just see what happens to your weight during that week. If your weight's drifting up, you know that actually you're consuming too much for where you need to be. So you have an honest look. What does my plate, what does my life look like? Is it necessary for me to go for, that extra snack? I know I'm guilty as well. I've had my evening meal and it gets to 9 p.m. I'm not tired enough to get into bed. And I don't know whether it's the biscuit tin or whether there's still a piece of chicken in the pot. I told you I'm the man of the house in my house now, so I can go for the extra chicken if I want to. And it's whether that chicken is going to benefit my life or whether it's just extra food that I don't necessarily need. I'm doing for enjoyment. Maybe I might need to find another habit to replace that. Maybe I should just open a book instead. Maybe I should get into my meditative habits, instead of going for something that I'm going to use to fill my mouth with instead.
Right, great. I mean, Sakina, is there any question from Facebook or YouTube? Otherwise, I think one thing I would like Alistair to just briefly summarize is the water intake, especially for men who are growing up. In the UK here, because of the weather, sometimes you really forget that you are supposed to be drinking water.
Yes.
How do we cultivate that habit of making sure we hydrate ourselves?
Oh, Dr. Robert, do you know that is a very good question, and I'm actually happy that we've made time for this. Just because when it comes to fluid intake, yes, water is great because there's absolutely no calories. It's got a little bit of electrolytes in there. It's got minerals in there, which are also great for your body. It's not going to make you gain any excess weight. But not everyone is a fan of water. That's the problem. Not many people can sit and drink sort of 2 liters of water throughout the day. So for people who who do get on well with water, what I would say is split it up. Think of 2 liters as 8 cups of fluid a day. Think of your waking hours of the day being about 18 hours. If you can get 200 mils of fluid in, sort of every, 2 hours, you're eventually going to get to your 2 liters of fluid. Maybe my math is a bit off, but, that looks like having a glass of fluid when you wake up, before you even brush your teeth in the morning, a glass just as you're having your breakfast, a glass, in the middle of the morning, maybe a glass or 2 glasses, and these glasses, I'm talking, they're 250 mils. So I've got a little bit of tea in my cup here. So 250 mils, if you're getting 2 glasses with your lunch and then 2 glasses with your evening meal, you're already at 6 glasses just before you go to bed. So you've got, an extra maybe 4 hours after your evening meal to get that extra 2 glasses of fluid in. If you're not a water drinker, then going for things like sugar-free squash is a really good way of getting really adequate hydration in. Some people are a bit funny with sweeteners like aspartame, sulfame K, things like that. I want to assure you from a food science standpoint, sweeteners are actually so heavily and so well researched. I would say sweeteners actually have a lot more evidence base behind them than sugar itself, because they've been trying to test the validity and the usefulness of non-nutritive sweeteners. And yes, there are some health risks with very, very, very high amounts of sweetener. And what I mean is, if you were to get a bottle of squash and you were to drink maybe 7 or 8 bottles of undiluted squash a day, yeah, of course, it's probably going to lead to some health risks. It's probably going to lead to some metabolic issues. But if you're drinking dilute squash and you're drinking 6 glasses of that a day, there's no impacts on your health. And the evidence documents that very, very, very closely. So I know people are scared of sweeteners, but I would assure you, do not worry. So examples of sugar-free squash, Iyabo, I've seen your question. Things like the Robinsons. If you go into the supermarket, you have to take a look at the back of the label. And if it says no added sugar, just take a look at the label. And on the label where it says the carbohydrates, you just want to see, is the carbohydrates less than 0.5 grams of carbohydrate per, 100 mil? If it's less than that, you know that it's very, very safe to drink. It's very, very, very low in carbohydrate or negligible amounts of carbohydrate. So go for it, drink it, dilute it with plenty of water, keep it ice cold. You can enjoy it, with this sun that we've been having. It's the best way to stay hydrated. Especially if you're going to be doing more exercise, which I know you're all going to be doing. I see Orlando getting himself prepared. So, with all the extra exercise you're doing, squash, get some squash in. You'd want to avoid fruit juices, full sugar fizzy drinks. You don't really want to be drinking a great deal of diet drinks either, because they don't hydrate you as well as water does. You can get herbal tea in if you don't like fresh water. You can do tea and coffee as well, so it doesn't have to be 8 glasses of water. It can be like 4 squash, 2 tea, 1 coffee, and maybe 1 pure water, that sort of thing.
What a nice way to end. I think it's better to just have fluid in there than nothing. So the best is try and, increase your water intake and then balance it with the rest. But it's better to have fluid than just nothing. So thank you very much, Alistair. I really appreciate your time and your knowledge, the skills, all that you have shared with us is going to be put into good use. I think I've learned something from it. I was just going to do a cup of tea, and then when you started talking about sugar, then I just said, oh no, let me let me not do that. Let me just go and have a glass of water. So sometimes you just need that motivation. And so thank you again, Shekinat. I think our time is up, and probably I'll just hand over to Orlando to continue with the physical activity part of the show. So thanks, everyone.
Thank you.
Welcome again. Thank you, Alistair. It's good to see you back on the platform. I hope everybody across YouTube, Facebook, and Zoom enjoyed that great, insightful seminar. Lots to take away. And if you wasn't taking notes, I advise you to maybe watch it again. All right. So my takeaways from that is fairly simple. It's calories in versus calories out. Really increasing those exercise levels and being patient with it as well. Like I said, like Alistair said, it's not going to happen overnight. All right. So be patient with it. Increase those levels, exercise levels, and calories in versus calories out. All right. I've had to do that myself over the years. I played basketball and badminton and football 5 days a week, like my teenage years to my 20s. But when I stopped, I kind of like when real life took over, I was still eating the same portions. So I did gain weight quite quickly. But now, to late 20s to now pushing 40 now, I really watch my portion sizes. So if I know, I'm quite active anyway, as you all know, but I know if I've got an evening in, I'm not going to have a massive plate of food, plenty of jerk chicken, dumplings, veg. I'll really try to collate my plate. So I might maybe have a quarter of a plate of rice and really kind of like decrease what I'm eating on a nightly basis. I'm going to be home. Because why am I having a big plate of food if I'm going to be sat on the couch watching TV? The energy from that food is just going to go to my body. So I try and really watch what I'm eating, or how much I'm eating, should I say. But everyone that's tuned in and enjoyed that seminar, I hope you're going to stay on for the exercise portion of today's session. As promised, we've got our last box exercise session for you folks. So I hope everyone's got plenty of water, nice big space. You might want to open the windows. It's kind of humid in here, but bam, I'm ready to go as usual. All right, so like I said, for today's session, plenty of space, plenty of water, and you will need your mats today as well, unless you're going to be hardcore and use the floor like myself. All right, because we've got one round where we're going to utilize the floor. All right, people. So let's get busy. Let's start with our warm-up. What I need from you people today, I need a 30-second shadow skip to start, okay? Let's get ready now. Let me sort my shoes out. Sort my shoes out. We're going to turn and skip. Get yourself ready. We're going to go on the jet. Start on spin. 3, 2, 1, go. Keep it nice and right. Let's get the blood flowing. Let's get the blood nice and flowing. On straight. Now cross. Let's go. That way, people. Okay, let's go to the body now. Get down. Jabs. Crosses to the body. 3, 2, 1. Uppercuts. Let's go. Let's get the shoulders going now. Really rolling shoulders. Let's get our shoulder capsule nice and loose, ready to go. Keep going, people. Three, 2, 1, on time, people. Give yourself 15 seconds. Catch your breath. All right, 5 seconds, people. Get ready. We're going back into our warm-up. So next move, 30 seconds. You guard and the jab, cross, left foot. Okay, if you're a southpaw, with your left hand, your strong hand, we're going to go the opposite. We're going to go boom, like so. Okay, so I'm right handed. All right, so jab, cross, foot. Get ready. 3, 2, 1. Let's get busy. Keep that going, my people. 3, 2, 1. Back to your shallow skip. Let's go. If you can, let's go on to one leg. If not, stay on 2. One leg. Stay legs. Back to 2. 3, 2, 1. Last move. I need 4 strings. Nice and quick. So you're going to go 1, 2, 3, 4. Nice and sharp. Get ready. 3, 2, 1. Give me 4. Let's go. Keep that going, people. Keep going, people. 3, 2, 1. Time, people. Well done. Give yourself a 30-second water break. And then we're going to step in the ring for round number 1. Well done. Okay, my people, listening. So round number 1, we have a combination round. Really gonna let them hands go, okay? So your first 60 seconds, as you know, every round is 3 minutes, full boxing round. So first minute, I want nice and strong in your guard, just like we just did. Jab, cross, nice and strong. You've been on our boxercise course for a while, these sessions for a while. Remember, we're boxing from the floor up. Okay, a lot of people think it's all about the arms and the shoulders. The power is really coming from the floor. All right. So remember, turn your hips, turn your legs into that punch. So watch, you can see my legs here. Lean forward, turn. Lean forward, turn. Driving from the floor. Watch again in my guard. Turn, turn. Really put that power, put that full body into your punches. All right, that's going to be your first 60 seconds, my people. Let's get in the ring. Let's get busy now. Come on. Let's get busy now. So 60 seconds. I need a jab, cross. Get ready. Let's go on the drop. 3, 2, 1, go. The body wash your hips. Halfway, it's going. Seconds. Keep going. Come on. Come on. Let's add to it now. So, after that last powerful cross, I need 10 uppercuts for speed. Nice and quick. So watch again. 1, 2, 3, 4, and then 10. Nice and quick. Then start back with your straights. Let's go. Second minute. 3, 2, 1. People. Wait, if you go to the country. Last 20 seconds. Keep working. Come on. 10 seconds. Okay, stop the clock again. Last edition now, guys. Okay, so after that last uppercut, we're going to come back with the straights for speed. 10 straights. Watch the whole sequence. Nice and slow. 1, 2, 3, 4, 10. And then 10. Straight back to your 4. So 4, 10, 10 for speed. Let go, people. Last minute. Come on. 3, 2, 1. Let's go. Put it all together now. Let's go. Keep going. Go, people. That's halfway, people. 30 seconds to go. Keep going. Come on. Fifteen seconds, people. Keep it going. Oh, that's nice. Well done. Back to your corners for a quick water break. We've got 40 seconds, and then we're back in for round number 2. Well done. 10 seconds, people. We're back in the ring. Okay, let's go, people. Round number 2 now. All right, so now we have a combination and conditioning round. All right, so we're going to throw some exercise, some conditioning exercises in there. All right, so combinations will stay the same throughout the round, or the exercises will change on the minute. So for your first minute, nice and easy. We've got 10 straights for speed, like we just did. 10 uppercuts, and 10 above the head. Okay, making that heart work harder, pumping the blood up. From there, we've got 10 star jumps. 10 star jumps. And then we go straight back into our combos. So 10, 10, 10, and then 10 there. Okay, so keep cycling through for that first 60 seconds. And then we're going to change the exercise, people. Right, let's get busy now. Come on. Get busy. 2. Okay, 10 straights, 10 uppercuts, 10 above the head, and starting. Get ready. 3, 2, 1, go. Keep going. Go through it now. Come on. Let's get that sweat on. Come on. Keep that going, people. 20 seconds to go. Keep going. 10 straights, 10 uppercuts, 10 above the head, 10 star jumps. Come on. 3, 2, 1. Let's pause the clock now. Okay. So as mentioned, combinations will stay the same. So 10, 10, 10. But now we're going to go for short jump squats. All right, so we're not trying to hit the ceiling. We're trying to get a little bit of space between the feet and the ground. Okay. So watch me. 10, 10, 10. And we're just going to go here. Nice short jumps for 10. Okay, let's go. Take a minute. 3, 2, 1. Then you look straight back to your combo. Keep going, people. Two, one. Okay, almost there, people. Almost there. So last minute, we're going back to start moves. So again, almost stay the same. 10 straights, 10 uppercuts, 10 above the head, 10 start moves. Let's go. 3, 2, 1. Let's go. Now go on, people. Come on. Seconds to go. Come on, people. Let's go. People. 10 seconds in. Now. One and time, people. Take your well-earned 40-second break. Ten seconds, people. Okay, people, last round coming your way. Bring your mats in, get your mats handy, or if you're going to use a floor and be hardcore, then that's all good too. So last round now, we're bringing the abs, we're bringing the core now, all right? So combo will stay the same throughout the round, but again, the exercises, the targets in the core will change. So first minute, I want 30 seconds of hard jab, jab, cross. Again, put your body into it. Use them hips, swivel those hips, drive from the floor. So it's going to be jab, jab, cross, nice and hard. Jab, jab, cross, solid. Jab, jab, cross. From there, we've got a 30-second forearm plank. Real quick. Yeah. Forearm plank right there. Hold nice and flat, nice and strong. Tense your bum. Take your mind elsewhere. And then from there, we're straight back into our jab, jab, cross. Let's go, people. Last 3 minutes now. Let's go, people. Let's go. 30 seconds, jab, jab, cross. Get ready. Let's go in 3, 2, 1. Let's get busy. Keep going, people. 10 seconds. 3, 2, 1. Down to the plank. Let's go. Second. Last 10. 4, 2, Oh, let's go. Oh, back here. Elbow. Let's go. Keep that going, people. 10 seconds. 3, 2, 1. Okay, going on the floor. Full sit up. Let's go. Go. 10 seconds. 2, 1. And go. Back to your combo. Let go. Down, down, cross. Come on. Keep that going, people. Five, 4, 3, 2, 1. Back on your bum. Legs up. You got crunches. Elbow to knee. Let's go. Let's go. 5, 4, 3, 2, 1. Time. Take on some water for 20 seconds and then you'll stretch off. Well done. Okay, people, back to your spaces. Top session there in the heat. Well done to everyone that took part at home. So let's cool down now. Let's calm the body back down. We're going to start up top with the neck. So let me go side to side like so. Let's go. One. Okay, we're going to twist the hips and reach. Both sides. Turn that foot towards the hand. Okay, ear to shoulder. Nice and gentle. Okay, either arm across your chest. Pull just beside the elbow, not on the elbow. Hold. Same arm behind the head. Pull down just beside the elbow. Change arms. Same arm behind the head. Let's get to the hips. Big rotations. Change direction. Front and back, nice and gentle. Shake it all off. And that's time, people. Well done. Chicana, you still in the house?
Yes, I'm here, Orlando. Thank you so much for that workout session. If anyone took part, please let us know in the chat, either on YouTube, on Facebook, or here on Zoom. Let us know how you found it. I can admit it's been a while since I've joined your sessions, because I'm always just working in the background, but I joined today and I'm like, yeah, this is this is intense, especially when you went from the jab cross and then to like the sit-ups and then the plank. I hate the plank. So it was challenging, but it was good.
Oh, okay, you look a little bit hot. Like
yeah.
Yeah.
Yeah, I think I wore the wrong clothes for this, but yeah, it was good. And I know today was the last exercise session. So what can we be expecting for next week?
Okay, so we're gonna go into body circuits next week. So let's start with the hardest one. So let's do lower body next week. So lower body circuits, Tabata style.
Nice. So that's what you guys can expect for next week's exercise session. And as for the nutrition talk, we will release the topics later on our socials, so keep your eyes peeled. And another shout out to Alistair and Dr. Robert for that session before. Very, very insightful. And if you want the slides from today's session, feel free to email us at health@khan.org.uk. Alistair has already kindly sent over the slides for us. And yeah, today's been an amazing session, a men's health special. Guys, ladies, if you're listening, please make sure to invite your husbands, your friends, because men in our community need to learn more about health and actually actively put in those habits we were talking about. Just making those small changes can go a long way. Yeah, any last words from you, Orlando?
Just like you said, it was a great topic today, and a topic that's not touched on enough. So yeah, thank you, Alistair. I've not seen him on the call for a while, so it was great to have him back on. Yeah, people just keep enjoying the sessions, keep tuning in, and we just hope that you're getting something out of it.
Definitely. And that's it from us today, guys. We'll see you next week from 6 p.m. Take care, everyone. Bye.